Okay, so let's get into our next topic, which will be hypercytokinemia, aka cytokine storm, and then this video will also include blood types in it as well. So this is really something that I think we're all interested in right now with what's going on with the coronavirus, because cytokine storm is something that happens with a novel pathogen, so a new pathogen, which is, if you haven't been exposed to something before, it's a novel pathogen to your body. You have to train your T cells and your B cells to be specific for it. Now, in the case of coronavirus, this pathogen is novel to everyone, which causes, obvious dangers because everybody's body is going to be responding a little bit differently. Some might be effective at being able to fight off a novel virus. Some may be not as effective at being able to fight off a novel virus. Another thing about it is that it's highly pathogenic, and there are of course degrees of how pathogenic something is. So something that a virus, if it gets in your body and it causes absolutely no symptoms, you would say like, oh, that's not pathogenic at all. Where one that causes you, just knocks you on your butt for weeks, that would be considered a highly pathogenic virus. Now, people's response to coronavirus is very variable. There are certain factors within the body itself, so everybody's immune system is different and will react in a different kind of way. So how pathogenic it is can vary from, maybe somebody doesn't get any symptoms at all, or they just have what feels like a cold. Or maybe they end up with severe pneumonia from this virus. So it can be very pathogenic, and it's definitely more likely to be highly pathogenic in any given person's body than just a typical cold. But everybody's immune system is different and will react differently to it. So each individual will have a different risk level. But what the danger is with a virus that is both novel and pathogenic, like coronavirus, is the risk of cytokine storm or hypercytokinemia. So normally when your immune system is responding to a virus, what happens is your T cells and your B cells are responding to the MHC marker. So your CD8s are sending out cytotoxic enzymes, your CD4s are sending out interleukins to stimulate your B cells. They're all sending out cytokines that help to stimulate leukopoiesis and lymphopoiesis, so creating more white blood cells, leukocytes and lymphocytes, stimulating those white blood cells to congregate in areas with chemotaxis, to phagocytize the pathogen, to cause inflammation. Now, inflammation is where we're going here, because we want this to be in check. You want enough inflammation to combat an infection, but you do not want so much inflammation that it is excessive. If you think of what inflammation is, it's an increase in blood flow to an area. So you're bringing more fluids to that area. And if this is happening in your lungs to an excessive degree, that can cause fluid buildup in the lungs. And when you have fluid buildup in your lungs, it's difficult to get air down into the alveoli, where it can cross over from the air that's in the alveoli that you breathe in into the blood and the pulmonary capillaries. So that's called respiratory distress syndrome, when you just can't get enough oxygen. You just can't move it through the alveoli because there's so much fluid in there. It's a feeling that everyone has had a little tiny touch of this feeling where you've got like a really bad cold and you feel kind of short of breath, or if you've had pneumonia, that is not quite respiratory distress syndrome yet, but it's getting a little bit closer. It's sort of like drowning, but in dry land, like you can't get enough oxygen. So this is the main issue, or the most immediate issue, really. There's other problems that having overinflammation, damage that can be done to your organs from too much inflammation, but respiratory distress would be, an obvious something that you would want to deal with right away, or something that you would want to fix right away. You also don't want to have too many leukocytes and lymphocytes around, because that can set up a positive feedback loop. As you make all these extra white blood cells, they send out more cytokines that stimulate more leukopoiesis and more lymphopoiesis, and they send out more cytokines, and more leukocytes and more lymphocytes and more cytokines and so on and so forth, all causing more inflammation and all leading towards the end result of respiratory distress. And that's where the word hypercytokinemia comes in. Too many cytokines, or cytokine storm. That's sort of shortened to the point. It's just a storm of cytokines overstimulating your immune system. Now, normally, your body has a way of keeping this in check, so preventing this from happening, keeping your T cells from going crazy, essentially. And those would be your Treg cells or your suppressor Ts. They can keep those T cells at just the right amount of activity without going overboard. But if the pathogen is novel and if it is highly pathogenic, then your immune system can just overreact like crazy, and it can quickly overwhelm those Tregs, and they cannot suppress enough for what's going on. Your immune system is just like gone off the chain, right? So it's gone crazy, and you have too many cytokines, and you have cytokine storm causing respiratory distress syndrome. So there are a couple of factors that causes the risk of cytokine storm, and this is what is causing people with coronavirus to end up on the ventilators. It's when their immune system ends up with cytokine storm. So it's good to know what the risk factors are. One is having a strong immune system. That doesn't sound like a risk factor, but it is in this case. If you have a strong immune system, it is very capable of responding to too much. So if it feels threatened by a highly pathogenic virus, it can overreact. Now, this does not seem to be the case with cytokines, with coronavirus, quite as much as it has been in past pandemics, like the flu of 1918. That was causing people with strong immune systems to get respiratory distress syndrome and die at a greater rate than, say, older people or people with weaker immune systems or babies, things like that. And that was because of this strong immune response from just young people. So you know when a disease has this going on if it's typically young, healthy people who are being affected higher. Now, that is not quite the case with coronavirus. What seems to be triggering cytokine storm, and again, everything I'm saying about coronavirus is, just what we know so far, and that's always something that could be changed, updated, amended as people study this a bit more and learn a bit more, because it is still so new that there's a whole lot we don't know about it. So what seems to be happening anyway is that a person with a slightly weak immune system, so their immune system still functions, but it's not completely able to 100% clear pathogens. So that person is sitting there in a state of chronic inflammation before you even get the coronavirus exposure. So they may not be walking around feeling sick, but they have something going on inside where they have a lot of inflammation. So this could be all sorts of chronic diseases that people can have, or just being elderly. Your immune system just kind of weakens over time as you get older, and you get exposed to like cold viruses or even allergies. All sorts of things are causing this inflammation response, and it can be perpetuated that you're not completely able to get rid of that little cold virus that you caught. You've got this cold virus and it's just hanging on for a while. So maybe you have the flu and then you get the coronavirus. That makes it all the much worse because you've got this already inflammation happening. Or let's say you have a chronic illness like advanced diabetes or something like that. Again, chronic inflammation. And then you come along with this novel pathogen, pretty pathogenic. You've already got this inflammation, a little bit of excess cytokines going on, and then this hits, and boom, you're at risk for cytokine storm. So how do you treat this? So in the case of coronavirus, they're slowly figuring out. They did, just last week, they did have some promising results with a steroid drug as a treatment, which is a typical treatment for cytokine storm or for respiratory distress, because steroids, such as, say, cortisone,